Turning the focus to the Ebola crisis and what it means for your health. Right now, a man is in a hospital in Dallas under isolation. He's the first patient to be diagnosed with the Ebola virus in the U.S.
And doctors say he traveled to Liberia, one of the nations in the epicenter of this devastating outbreak. With this being the first case diagnosed in the States, there's still a lot we don't know about Ebola here, so we wanted to answer your questions. And joining us now from Swedish Medical Center, Dr. Kathryn Springer. Thank you for being here, doctor.
Thank you.
What do you want us to know about Ebola and how it spreads and who's at risk?
So I want people to know that it's not going to spread like it does in West Africa. We have the ability to contain this virus very well here. We know how to identify patients quickly, and then we know how to put them in isolation so that no further spread happens. It's spread through bodily fluids. That means for me to acquire Ebola, I need to be in contact with not just a patient, but fluids from the patient, such as vomit or feces or blood, sweat, body fluids. Just being in casual contact, such as being on an airplane with someone, is not going to put me at risk of catching the disease.
And all the precautions that doctors have taken in Africa, some of them have still contracted it. I mean, that makes me think even if they know what they're doing, they're still catching this. Is it a different situation over there? Is that why that's happening?
It's a very different situation there. And I can't say exactly what the situation is for healthcare workers there, but they clearly don't have the resources that we have here. When we see a patient with Ebola in the United States, once it's suspected or diagnosed, that patient will be put in what we call isolation. They'll be in a private room with a private bathroom. And anyone who enters that room will wear what we call PPE, or personal protection equipment, which is a gown and a mask that covers the eyes, and gloves so that their skin will not come in contact with body fluids at all. I don't think they have the resources to do that in Africa. They certainly don't have, individual private rooms for patients, and they don't have the ability to use a separate gown and gloves for every patient. They just don't have those resources.
Dr. Springer, that helps a lot. It puts us at ease. Thank you for coming in this morning.
We'll be right back with more Good Day after this.